So Solomon built the temple and completed it. He lined its interior walls with cedar boards, paneling them from the floor of the temple to the ceiling, and covered the floor of the temple with planks of juniper. He partitioned off 20 cubits at the rear of the temple with cedar boards from floor to ceiling to form within the temple an inner sanctuary, the most holy place. The main hall in front of this room was 40 cubits long. The inside of the temple was cedar carved with gourds and open flowers. Everything was cedar. No stone was to be seen. He prepared the inner sanctuary within the temple to set the ark of the covenant of the Lord there. The inner sanctuary was 20 cubits long, 20 wide, and 20 high. He overlaid the inside with pure gold, and he also overlaid the altar of cedar. Solomon covered the inside of the temple with pure gold, and he extended gold chains across the front of the inner sanctuary, which was overlaid with gold. Da 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 da. Ladies and gentlemen, that is First Kings, and I'm reading from chapter 6 from around 14 to 19 there, about 19, 20, 21. Now, we're seeing Solomon, and he, between chapter 5 and chapter 7, he first started building the temple of the Lord. Then he went on to build his palace. What I'm reading is just an excerpt to help you understand that he was using details to build this temple and later his palace. 20 cubits long, 5 cubits wide, the portico overlaid with gold, pure gold, and it was like this and that and the other and the other. Now we know that he was the wisest man that ever lived and ever would live. The Lord God had given him wisdom. And from my previous episode, I had explained that to me, wisdom was what to do, when to do it, how to do it, with who to do it, all the why, www, and H. So it is pretty much what God himself would do. If he was to come down and build this temple or build the palace, what exactly he would do is what Solomon was doing. And he was getting that wisdom from God to do this. Now backtrack with me to Genesis chapter 1. In the beginning, the earth was formless, it was dark, it was chaotic, the water had filled the earth, there was nothing, it was formless. Then God and the Spirit of God was hovering over the waters. Then God said, "Let there be light," and there was light. And the Lord saw that the light was good, separated the light from the darkness, called the light day, and the darkness he called night. So there was evening, there was morning, that was the first day. Then the second day, let there be an expanse between the waters to separate the waters above from the waters below. He called the expanse sky. And then there was evening, there was morning, that was the second day. Then he separated the waters, let the waters separate from the land so that there was water and there was dry land. He called the gathered waters seas, and the dry ground he called land. And then he saw it was good. On the land he created the vegetations, plants with seed in them, and trees with fruits and seed in them. Then there was evening, there was morning, that was the third day, and on and on and on, one after the other. Now, like I've said, God is the custodian of wisdom. He could have pretty much said, "Let there be creation." And the light would have appeared, the expanse, that is the sky, would have come, the waters would have gathered together, the dry land would have appeared, the animals, the vegetation, everything would have been in place just by the pronouncement of his word. When you read Proverbs chapter 3, verse 19, it says, "The earth was founded on wisdom." So it is that wisdom that the Lord is using to create the earth, that Solomon is using to build the temple and also his palace. One more. In Genesis chapter 6, we have Noah. Now the earth has become violent. The Lord is unhappy with the creation, and he decides to destroy the whole earth. But he was going to save Noah because he found him righteous. Now Noah had a wife with the 3 sons and their wives, and the Lord was saving them all. But he gave him instructions, as I had described previously. Build the ark of cedar wood, cut it with pitch inside and outside, put 3 decks, lower, middle, and upper. Let there be rooms inside the ark. Let there be a door on the side, a roof, and an opening below the roof, 1 cubit high. Then the ark itself, let it be 300 cubit long and 50 cubit wide and 30 cubit high. So again, wisdom is at play, and these are instructions, one after the other and the other. So who are we in nursing? Not to use wisdom in also doing what we are doing. So in nursing, generally, you'll find instructions about just about everything. Instructions on how to wash the hands, instructions on how to bathe a patient, instructions on how to feed a patient. There's a manual, and that manual has instructions. Do this first, then do that, then do the other. Nursing is a ministry. Then, in our discussion today, we are going to take off from where we had left previously. Remember, we were talking about the chains of survival. And we had 6 links in this chain. The first one was preparation and preparedness. And the second one that we discussed was activating the emergency system early. Now the third one is high quality CPR. Please, if you are lost, watch our previous videos. Our new viewers, I welcome you. My name is Ludia Osita and I am a registered nurse. This platform was formed to help you understand how nursing is a ministry and also as a profession. And for the returning viewers, once again, I thank you for returning, and you are also welcome. Now, let's take off. For the returning viewers, you may understand better. For the new viewers, kindly watch the previous video to be able to understand what our discussion is today. For the benefit of time, I cannot review so much of the previous ones, but I've explained so much in detail. Watch it, and then you'll get to understand it better. So let's keep going on. We do not want this link to be the weakest link. This one of performing the CPR, high quality CPR. So what you're going to do is to follow instructions. Like I've said, wisdom is also about instructions. What to do, when to do it, how to do it. Now, in this link of high quality CPR, our victim now requires the CPR, the cardiopulmonary resuscitation. And now for us to ensure that it is high quality, because there's a difference between doing something and doing something well. It's not just about doing it, but doing it well. So to ensure that it is high quality, there are certain parameters. This CPR, we have to do high quality CPR. There has to be minimal interruptions in the performance of the CPR, and then there has to be early defibrillation. Remember, defibrillation, I said, if it's outside the hospital, for the layman, for people who don't have medical background, we use the AED, the machine that was called the automated external defibrillator, that I explained how easy it is to use. So we have high quality CPR with minimal interruptions plus early defibrillation. And of course, if it's in the hospital, instead of an AED, they use the defibrillator, which is a more advanced AED kind of a machine. Now, here we are, we have those 3 parameters that should be observed. So for the first one, the high quality CPR, to ensure it is high quality and not just simply CPR. Remember, CPR had to do with compressing the chest and giving the breaths. Compressing the chest and giving the breaths. When we are compressing the chest, we are trying to get to the heart. And we say the heart is on the left side, the left upper side of the chest. That is where the heart is, around this part. So when you are compressing the chest, pretty much we're trying to compress that heart. It's like a balloon. When you compress it, and then when you release the compress, it bulges back again. Then when you compress it, it flattens and it bulges. Now, for it to be high quality CPR in matters compression, one, that compression has to be done within 10 seconds of recognizing that this is a cardiac arrest. How do we recognize it? First of all, check for responsiveness. There's no responsiveness. Check for the pulses. For the adults, we're checking on the carotid pulse. And for the pediatrics, children, infants, the children too, we can check the carotid. With the adults, we check here. Then the infants, because their head is much bigger and their neck is smaller, we use the brachial pulse, as I had explained earlier. So checked responsiveness, we're checking pulses, or both of them are absent. While you're checking the pulse, you're checking breathing. I did request that you go ahead and practice with somebody, somebody who is sleeping, to check for the breaths. Are they breathing in and out? If they seem to be there, is it normal or are they gasping? So if the 3 of them are absent, then we're dealing with a cardiac arrest and we need to start CPR immediately. Now, high quality means we need to do all these checks within 10 seconds at most. Not just the checks, but even activating the emergency response system. Because we find out they're unresponsive, we have to call for help. That's shouting for help, and then you've determined there is no response, you shout for help. We have a window of about 10 seconds. Remember, the importance of this time sensitivity is the brain needs that oxygen and blood. Without it, and the time goes running out, then the patient's outcome may be very poor. Even if they survive, they may end up with disabilities or even in a vegetative state, which you do not want to bring somebody back to life only for them to be incapacitated. So minimal interruptions. So the CPR should be started within 10 seconds. Meaning, if you practice now how to identify these parameters, should you find a real life situation, then there is a possibility you can do this within 10 seconds at least. Now, the second thing, these interruptions could happen. Maybe you've already started the CPR, you've been compressing. Interruptions in the compressions could happen in such that maybe the AED has arrived, somebody whom you had activated to call, you've called for help, what have you. When the AED comes, they have to put the patches and then analyze on the machine and shock the heart, or the defibrillator, they have to do that. All this means the pumping is not ongoing, because now you have to put the patch here, and yes, that means compression has to stop. All that interruption should not be more than 10 seconds. So remember that term, 10 seconds. Any kind of interruption, just remember 10, 10, 10, 10. So if you notice that you're doing things, maybe you're moving the patient, trying to reposition them. If you do it for long, you're dragging them, trying to reposition them, doing all this, that is time wasted. It is more than 10 seconds. And that means, much as you may end up doing the CPR and the patient returns and you're rejoicing, the outcome may not be as good as if you had tried to keep all these interruptions within 10 seconds. That is number one of the high quality CPR parameters. The second parameter is ensure that the compression is done hard and fast. Hard and fast. How fast? Let's start there. How fast? When you are compressing, you want to do it at a rate of 100 times in a minute, not less than 100. And you are allowed a maximum of 120 times in a minute, not more than 120. If you do it less than 100, you're doing it too slow, not effective. If you're doing it faster than 120, you're going too fast. Again, not effective. The reason or the rationale is this. When you are pressing that heart, you're pressing on the chest, that means you're pressing on the heart. So when you are squeezing it like this, if you do it too fast like this, when does the heart get time to refill with blood? Because every time you do this, you've squeezed that blood to go to the brain, to go to the rest of the body. And every time you've released the compression on the chest, the heart comes back open, and that creates a negative pressure to allow blood to fill back into the heart. Then you compress the chest again, meaning you've compressed the heart, and that squeeze sends the blood to the parts of the body. So you want to do it effectively, and effectively means at a rate of 100 in a minute. You can go to 105 times in a minute, 115, 119, 120. The moment you start going more than 120 times, you may think you're doing a good job, but you are simply doing this to the heart. So there's no time for the heart to fill. Therefore, keep the rate at that. Now, how will you know you are going that fast or that slow? The importance of practicing. Take your watch, take a timer on your phone or your watch, and practice. Now, to count 100 or 120 seconds in a minute, times in a minute, you can count 1001, 1002, 1003, 1004, 1005. Every time you say 1001, that is 1 second. When you say 1002, that is 2 seconds. So 1001, 1002, 1003, 1004, 1005, 1006, those are 6 seconds already. So take a timer, take a watch, and watch it go for a full minute. It is good if you have the watch that has the clock face. So you check the second hand as it moves. Then when you count 1001, 1002, 1003, you should go 100 times or 120 times in that minute. That is high quality compression. The speed is good enough. You are doing effective compressions. You're not going too fast, you're not going too slow, and the blood is being collected and supplied effectively. All right, so having said that, that is the speed. Now, how hard and how fast? That is how fast you should go. How hard? Remember our adult, our infant, and our child, and the parameters that determines who is an infant, who is a child, and who is an adult. Now, when you put, for CPR, when you're performing CPR, it should be on a flat, hard surface. Not on the bed with a mattress that is bulging, because as you press them, they are going down, so you're not able to compress the heart. So wherever you may be, the bed has to be firm, if at all it was the bed. If they were seated on the couch, then you place them lying flat, maybe on the floor, for it to be effective. So always remember the surface has to be hard. We'll talk about it when we're discussing further about CPR. But how hard means if the victim is lying flat and you look at them from the side. You put them lying flat, here's the head, here are the legs, and they are flat, and you look at them from the side. From the chest going downwards, you can, the top of the chest, a third of the chest, middle, second third, and the final third. 1, 2, 3 layers on the side. For the infants and the children, when you're compressing the chest, it should be at least 1/3, a third of that depth. So when you're pushing on them, you shouldn't go too far. It should be at least a third of, a third of the depth of the chest, or at least 5 centimeters for the child and 4 centimeters for the infant. I hope I haven't confused you. For the infants and the child, if you place an infant or a child lying flat and you look at them from the side, you'll be looking at their lateral view, this side. So from the chest, going down a little bit, that may be the first third. Then the middle part may be the second third. Then the final part that touches the floor surface, that is the third third, or the final third. So when you are pressing on their chest, it should be a depth of that first third. So that by the time you're going too deep, either you'll know I'm going too much in, or I'm not doing it effectively. But remember what we said the other time. You'd rather save the life, you'd rather break 1 or 2 bones than lose the patient. So you want to at least ensure that you're going a depth of a third. You can go in deeper. As long as this victim survives and they're whole and they're safe, it is better we deal with that broken rib later than losing this child. So the depth tells us whether at least we are compressing the heart effectively. Now, if you may not quite understand about thirds, we can talk about 4 centimeters for the infants and 5 centimeters for the child. My thumb is about 6 centimeters, 6 or 7 centimeters. It's a bit long because I did a lot of thumb sucking. However, go ahead and use a ruler and measure your thumb. Where you see 4 centimeters, that is how deep you should compress on an infant. So it will give you a rough idea. If your thumb, mine is 6, so if I have to determine maybe 4 centimeters, I'll know when I'm compressing the infant, I should go a depth of, I should at least try to aim for 4 centimeters, this deep. So when I put this on the side of the infant, I may have an idea. Not every victim will you be able to be measuring with the thumb. You don't have time. Remember, minimal interruptions. But at least when you're practicing, go ahead and use your thumb. Figure out how long your thumb is, and then you will know this is how deep I need to go. Measure it on the infant, then you'll know, okay, anytime I'm doing on a victim who is an infant, this is sufficient enough. This is a sufficient enough depth for the infant. Now, for the infant, it's 4 centimeters. For the child, it is 5 centimeters. Similarly to the adult, at least 5 centimeters, but not more than 6 centimeters. So for an adult, I should go more than 6 centimeters, but I can do between 5 and 6 centimeters. between 5 and 6 centimeters for the adult. Now, this parameter tells me I am compressing the heart effectively and the heart is refilling quite well. That is our second point. Another factor for high quality CPR is we should allow the chest to recoil. By this, I mean when you're pressing on the chest, you're 4 centimeter for the infant, 5 centimeter for the child, then 5 centimeter for the adult, but more than 6 centimeters. When you are doing that compression, allow that chest to come back fully, recoil fully. So that you're not doing this, you'll only be bouncing on the heart and you're not allowing the heart to open up fully and receive blood, then squeeze it again to send the blood around the body, then allow it to again expand fully before you squeeze it back. So if you keep compressing and you're not allowing the chest to recoil, press on them, allow the chest to recoil. Press on them, allow the chest to recoil. Keeping in mind your rate of between 100 to 120 in a minute. So when you do that, ensure that at least you're releasing, you're putting the pressure but releasing it from the chest. You put the pressure, then you release it. That way you're pressing the heart and allowing it to, the chest and allowing it to recoil. That means the heart is squeezed and also opened up fully to receive blood. That is the third factor. The fourth factor, do not lean on the chest of the patient. Don't lean on them when you're compressing. Because sometimes when you're doing it, your arm, your elbow, or your hand is still on the patient. That one does not allow for full chest recoil. You're also not doing much. You're simply pressing, but the heart is not being allowed to open up to receive blood. So do not lean on the patient when you're doing the compressions. Only allow this part to press on them, lock the elbow like this, and that way, as you're pushing on the patient, you're effectively doing the compressions. Fourth factor. Our fifth factor has to do more about now the breaths. Remember, CPR has to do with compressions and breaths, compressions and breaths. So you are working on the heart, sending the blood. Now you're giving the breaths. Peradventure, you have the bag. Remember the bag valve mask if you're in hospital, because I'm talking about outside and inside hospital. It is all CPR. If you're in hospital, you have the bag, the valve mask, the BVM. If you're outside hospital, you may have to use your breath. If you are finding it safe to give the breaths, maybe it's a family member or there's no contagious infection, even if it is a family member. If it is outside and you do not know the person, you do not feel safe at all giving breaths mouth to mouth, do the compression alone. It is allowed. That is called hands-only CPR. It is okay. You don't have to give breaths if at all you don't find it safe to do mouth to mouth, but you can go ahead and just do compressions alone. That is called hands-only CPR, and it will still be effective in saving the patient. So when you're giving breaths, peradventure you found it safe to do so, the breath should be done within 1 second. Remember, we will talk about how many breaths for the adults, for the infants, pediatrics and all. But in this case, just know that there's breaths to be given. Whenever you're giving a breath, it should be within 1 second. So don't go blowing that you're taking long. In your mind, you should be counting. Remember, 1,001, 1,002, 1,003. So if 1,001 is 1 second, when you're giving the breath, you should be doing 1,001. That is enough breath for one breath. So you do it within 1 second. When you are doing it, your eyes are on the chest to ensure that the chest rises. Because when you're giving the breath, it goes through the windpipe to your lungs and the lungs expand. Believe it or not, try it on somebody in the house, wherever you are. Let them lie. If they can follow instructions, tell them to hold their breath, not to breathe. Play dead. When you blow in their mouth, you will see their chest rising. Now, the higher it rises, that a good chest rise means indeed you have put the air down their nose or mouth. Down their mouth, it has gone down their trachea, their windpipe, and it has caused the lungs to expand. You've given them good air into their lungs. But if you see a slight rise in the chest, then you're not giving enough. You may feel you've given so much, but some of the air went through the food pipe, the esophagus, into the stomach, because we have the two adjacent here. One is the windpipe, the other one is the food pipe. There's one in front of the other. So when you put the air through the mouth, guess what? It could either go down the food pipe into the stomach, or it's going down through the windpipe into the lungs. So when you see the chest rising well, then you know that a good percentage of the air you have blown through the mouth has actually gone to the lungs where it is needed in this scenario. And 1 second ensures that you're not blowing too much, and you're not blowing too much into the lungs, of course, and you're not blowing too much, and some of it is going to the stomach while the other one is going to the lungs. So breaths of 1 second, and also ensuring that there's a chest rise with every breath that is delivered. Now, ladies and gentlemen, we've talked about the compressions, how they should be done. We've seen also how the breath should be given. These two make good CPR. If there's somebody who does not understand CPR, they can still do this under instructions. So for instance, you're there doing it and you're getting tired, and there's somebody else around who's never done CPR, but they're there, they want to help, they're encouraging, they're also, you can tell them, come, compress. And as they're compressing, you're ensuring that they're doing it 100 to 120 times a minute. So because you've already known, it's just about you telling them, just press. You're not even telling them count. It is you who will be seeing they're doing below 100. It's not effective. So you may tell them, please, faster, faster. So when they're doing it and they're not doing it hard enough, now that you know about the depths, you can tell them, please, increase the depth, push harder. So when they're pushing harder, you know that yes, you are compressing effectively, and when they are going fast within the 100 to 120 times a minute, you know that they are going fast enough. And at that time you are resting, then you switch again. You come in and you continue compressing, maybe when they're giving the breaths. So under instructions, anyone can do it. I'm not just sharing this knowledge with you for yourself alone. But in case you find a situation, don't think that I'm the only one who knows CPR, so I have to do all these compressions and the breaths until the advanced resuscitation intervention arrives. No. You can also use the people around. I realized about, I think it was 2 episodes in the past, I had finished my presentation with you. It didn't take 3 hours, and I had a scenario. But this was not a cardiac arrest. But you can imagine having presented and you see somebody in that state. What goes into your mind? You start looking, are they responsive? Do they have a pulse? Are they breathing? The mind went there until I saw clearly this person is moving. Why are you even checking about responsiveness? And they were obviously breathing. So all I needed to do was just to check the pulse. And the good thing is where I was, they had an ambulance in the setting. So, and the nurses had already been called. So they were on the way. So mine had to just do first aid, loosen clothing, ensure until the team came to now carry on. But you see, I'd finished the presentation. It was the presentation before the previous one. So we're talking about 2 weeks. I finished and I went where I was going. I'm seated, and where I'm seated is where they're bringing the victim, because it did not happen right where I was. It happened about 50 meters away. So they were carrying the victim, a lady, from the arms and the legs, and they were bringing them toward me, and I said, now, it had to be directly toward where I was. Because where I was sitting, there were seats. There were not benches, seats, rows of seats. So they were coming to place the person on the seats instead of on the floor, right where people were passing. It's been a long while since I saw an incident outside the hospital. It's been years, to be honest. It's been quite a long while since I saw it outside. Of course, not counting the accidents on the roads and all that, but just an incident whereby now you are right there. You are seated right there, and then it happens. So thank God it was not a cardiac arrest. But if it was, I had already spoken about it. It was a matter of moving into action. But there was no need for CPR. There was no need for resuscitation attempts. It was something else, high blood pressure, and it was managed. They went in the ambulance and they were taken for further intervention because the setting had the nurse, it had the doctor on site. There was an ambulance that had to be called across the road. it was a unit, which was very good. It shows you the importance of having these systems in organizations or in offices. Should it happen, there is something that can be done to save the life. So, ladies and gentlemen, we've talked about high quality CPR with minimal interruptions. Keep it less than 10 seconds. Remember that number, 10 seconds interruptions. And then early defibrillation. So the AED can be found, the earlier the better. If it can be done, then the chances of survival doubles or even triples, because all these have been done fast, making this link a strong link, hopefully the strongest, because this is the core of the chain of survival. Having to send that blood. It doesn't matter if you are prepared, it doesn't matter what have you. All of them are important. However, this is the meat of this chain, because now it matters whether the heart is compressed to jumpstart again, the blood is sent around to the brain and the rest of the body. If it is not done, then there's no patient to continue to the advanced resuscitation intervention link. There's no patient for post-cardiac arrest care. There's no patient for recovery. You've lost the patient at this link. So it is very good that at least we get that in mind. Now, we've talked about the compressions and the breaths. Please remember, watch again the video to understand what I have discussed. When we are doing this, we're following these instructions. This is wisdom. This is wisdom delivered. These are the instructions. Remember the building of the temple, the building of the palace, 300 cubits long, 50 cubits wide, 30 cubits high for the ark. Creation, let there be, separate this, put this, let there be this, it is good, it is good, it is very good. Bit by bit instructions. These instructions are the foundations now of the CPR. So it doesn't matter if you know that for the adult, we do 30 compressions and then we give 2 breaths, then we do 30 compressions with 2 breaths. You may be able to compress and give 2 breaths, but are you doing it effectively? Are you compressing at the correct depth? Are you giving the breaths within 1 second? Are you checking on the chest rise? Is the chest recoiling during compressions? Are you leaning on the patient when you're doing it? So you can see how few they are, but they are effective. So by the time you're doing it, whether it is adult or a child or an infant, and you apply what I have discussed, guess what? You have delivered high quality CPR and given this person a double or 3 times chance of surviving, and even post the entire cardiac arrest episodes. You've increased that statistics of 10% of them making it to discharge. We are now talking 80 to 90% of the people that go. So you may do it and then go about your way, but at least in your mind you'll know we did the best. Hopefully the next link they'll do their best, and this person will survive and recover and will have less disability all around of every cardiac arrest patient. So remember our scriptures, remember what I have discussed, and you have a beautiful weekend ahead. Until then, my name is Ludia Osita, once again a registered nurse. Have a beautiful week ahead. Thank you. Goodbye.